All right. So you see the galaxy, it's glaucoma. You see Vin Diesel in any way, it's autosomal dominant. You see any type of rhesus species, it's rhesus autosomal recessive. This is Sturge-Weber. Take this out of the way. So Sturge-Weber, the first thing is it's sporadic. Okay, it's not inherited. So is Wyburn-Mason. It has the galaxy behind it, so it is associated with glaucoma. There's two ways that they're going to test you if it's associated with glaucoma. They'll say it's either the kid is before 10 years old or after 10 years old. If it's after 10 years old, the reason he has glaucoma is because he has increased episcleral venous pressure. If it's before 10 years old, then the reason is because of any kind of angle abnormality, just like congenital glaucoma. And the way that you help remember it's sporadic, not inherited, is because Spider-Man was bit. This has leptomeningeal vascular malformations, so that can lead to calcification. And it has the port wine stain, and it has the ipsilateral, so this is the right eye, and it's got the right side choroidal hemangioma, and it's going to be diffuse. It's not going to be localized. So what you have to remember is you have to remember ketchup fundus, you have to remember port wine stain, sporadic leptomeningeal vascular malformations. Then you have NF1. I remember it with Glee. This is a song von Wrecking Ball because it's von Recklinghausen. So this is what the neurofibromatosis look like. And if you have a plexiform neurofibroma, then this is also associated with glaucoma. Thus, she's swinging in a galaxy. The reason why it's Glee is because of optic nerve gliomas is with NF1. It's really funny, man, because they're gonna put a glioma, and then they're gonna put in like Sturge-Weber, NF2, and you may just jump to, oh, it's neurofibromatosis, but it's not NF2. NF2 will be meningiomas, but not optic nerve gliomas. Gliomas is NF1. Within the NF1, you'll have the Rosenthal fibers. These are pretty much just degenerating cell processes within the optic nerve gliomas, and they're considered a pilocytic astrocytoma, grade 1, and it is also autosomal dominant. He's singing, and then it's also associated with cafe au lait spots. She's drinking coffee, and then sphenoid wing dysplasia. The way to treat it is you actually just watch it, because if you try to remove it, then you could just cause blindness. But if this starts to really hit the nerve, then you can consider doing surgery or radiation. Then you have NF2. The way I remember NF2 is with schwannoma, is black swan. There's a scene where she's in the train track, and this helps remember the tram track sign, which is seen in MRI for optic nerve sheath meningioma. So NF2, schwannoma, tram track, she's in a train, and there's a bunch of posters in the train, like there's a Spider-Man poster, but this is now for meningiomas, not leptomeningeal vascular malformations that's seen with Sturge-Weber. This is meningiomas, which is found anywhere in the brain, in the meninges, around the nerve, etc. Within the meningioma, you'll see the Antony A and Antony B biopsy. This is again different than nerve glioma, which has the Rosenthal. And then this is associated with posterior subcapsular cataract, thus the Katz poster. Again, this is autosomal dominant. It's chromosome 22 on NF2. This kind of helps remember the 2 in NF2. It's chromosome 22. Just other stuff that's kind of lower yield. It's associated with morning glory disc anomaly. And this is a song where she disses a bunch of people, so it's associated with fibrous dysplasia. You treat this with radiation therapy. So it's different than optic nerve glioma, where you just kind of wait. This is TUBErous sclerosis. You're watching the tube, and it's on DJ Tiesto, so TS for TUBErous sclerosis. And he's kind of playing in this forest, and you're also eating and watching Bernieville Pringle disease, because that's what it's also known. The reason why he's in the forest is because there's a lot of like ash leaf spot. They'll mention shagreen patches, so that kind of helps remember the TUBErous sclerosis. These guys, so they don't have meningiomas, they don't have optic nerve gliomas, they have astrocytic hamartomas in the retina. This is of the nerve fiber layer. One of the ways that you could just quickly diagnose this patient, you look at their thumbs and you'll have periungual fibromas. And then the triad is seizure, mental retardation. And the reason why it's mental retardation is because they have these cortical tubers that can calcify, and they have the skin findings like the periangular fibromas, the shagreen patches, and the facial angiofibromas. This is kind of also very pathognomonic. Lastly, it's also autosomal dominant. It can affect 2 of the genes, either chromosome 9 or 16. Tuberin, which helps with TUBErous sclerosis, and hamartin, which helps with the astrocytic hamartomas. And then you have really just a couple more phacomatoses left. This is the last one of the last ones is ataxia telangiectasia. I remember it with Lewis and Barr, Roseanne Barr. This is the ATM gene. It's involved in the repair of DNA. Just remember that there's an ATM in the bar. And then if you have the ATM gene messed up, then you're very sensitive to sunlight, so it causes a lot of different types of skin cancer. They also, the female carriers who pass it on to their kid, the female carriers who are not homozygous, who are heterozygous, have a 7 times higher risk of cancer. And then it's ataxia, not just of the body, but of the eyes as well. So one of the first things that we catch is an impaired ability to initiate the saccades, which is a type of ataxic movement. And then another way that's associated with cancer is that it has an increased risk of T-cell leukemias, and then hypoplasia of the thymus, which can make them very sick as well. These kids usually die pretty early, I think. It's also autosomal recessive, so she's taking the rhesus pieces, and then this kind of helps you just remember how he's dancing, and then these are the telangiectasias, which can affect pretty much anywhere in the body. Wyburn-Mason, the only thing you have to know is just how it looks, and this is how it looks. It looks like a Medusa's hair. Von Hippel-Landau, you have to know a couple of things. Number one, it's chromosome 3, which is easy because it's von Hippel-Landau, 3 words. And then it's associated with renal cell carcinoma, RCC. So these guys, you have to just worry about kidney cancer and pheochromocytoma. And then the hemangiomas are called hemangioblastomas, and they kind of look like they're little bombs they're about to blast. We have a couple actually in Ben Taub, and the way to treat it is you do laser on these, but what you also do is you do an FA to look for the very small ones that you can't see on fundus exam. So you want to actually catch the earlier lesions more than the later lesions. And then you have to always make sure that they have a family workup and they have to go to their primary care doctor. And then lastly, this is a cavernous hemangioma. You know that a retinal cavernous hemangioma can occur in the orbit. It's one of the most common benign findings of proptosis in adults, but this is a cavernous hemangioma of the retina. And what you have to think of is 2 things. It looks like a grape, and when you do an FA, it's got this blood layering. That's it for phacomatoses. We're done for phacomatoses.